The next session is Helen, Jason and Julia. This is live data visualization. There's going to be no live data, is that correct? Yeah. Great, thank you very much. So, starting with you, Helen, what are you most proud of from your working life?
I'm going to go with when I set up a National Domestic Abuse Forum through the National Housing Federation to basically share good practice around social housing and report the feedback from serious case reviews so that we could share learning and save lives. And I'm so delighted because as of September, I'm hoping it's still there, but it was still running as of September. So it's a fantastic piece of work.
Thank you very much. Jason, the only man in a suit. You're terrifying me wearing a suit. Over to you.
I think in my current role, I would say probably being part of the work that brought in a national branding for YMCA England and Wales, which was quite a significant task for an organisation that was 170 odd years at the time, years old.
With 170 different opinions, I'm sure. Great. And Julia?
Well, mine probably is setting up and establishing the Cadent Foundation. So I've had over 30 years experience working in the gas industry, very corporate, and it was an opportunity to be able to give something back. So being asked was quite an honour at the time. So yeah, I'm really proud of what we've done.
Thank you very much. Okay, Helen will moderate and I will tell you about timings. Well done. Over to you, Helen.
Fantastic. Thanks, David. So, Julia, we're going to start with you. If you could just introduce your organisation and the journey that you went on to get to the point of live data visualisation. I know it's going to be quick, but go for it.
Really, really quickly then. So I work for Cadent, which is a gas distribution business. A lot of people haven't heard about us. We dig a lot of holes. We replace a lot of pipes, but we also operate the National Gas Emergency Service on behalf of the whole country. So we have a unique opportunity where our engineers are entering people's houses on a daily basis. And unfortunately, a lot of that time we are disconnecting people because of a gas escape or carbon monoxide in the home. So it's not a great experience for customers. And it's not a great experience for our engineers either. So in 2019, we were asked to establish a foundation. We weren't quite sure what it was going to be, but we decided to go with a donor-advised fund model, which means we sort of sit as a middle party, really. Cadent donate a percentage of its profits, post-tax profits, to Charities Trust, who are our charity partner, and then we sit in the middle and we have to advise where we direct that funding. And we started off in 2019 doing just that. We've got money, we need to spend it, and let's give it out to communities, to people, organisations that could do some really good stuff. That was great. And then for the first 18 months, we did that, and we had no experience of the third sector, no experience about how charities operated, and we had huge amounts of data, because people were saying, well, what do you want us to report on? So we were saying, we'll just give them a whole list. We just sort of Googled, what do people report on? And we had data everywhere. It was a bit of a mess, but we kind of got through it. We decided that we were doing too much and we couldn't really explain our impact and what direction that we were going in. So we took a stop, drew a line in the sand, got in touch with Trust Impact, and then we went on the whole journey of theory of change, measure what matters. I wanted the shiny dashboard, to be perfectly honest. I saw that first and I was like, oh, I want one of those. But then Matt explained that we have to go through, and what you've heard about purpose and everything else. We've been on that journey now for 3 years, and we're getting there, I think, is the answer. So that's my...
Fantastic. Everyone wants the shiny dashboard, Julia. You would not believe the number of conversations we have about those. Jason, over to you. You've got 180 years worth of stuff to cram in.
Well, as I say, the YMCA was founded in 1844, actually less than a mile from here. It's grown to be a global organisation, present in 120 countries. Here in England and Wales, we do housing, we do training, education, we do early years, youth work, gyms, sport, and serve about 400,000 people every year. And yet, for the most of the population, when you say YMCA, they think of village people and the song. And it shows the challenge that exactly And I can't tell you how many parties I've been to where people play the song because they think it's funny for me. But that shows the challenge that we've had, certainly the last decade or so. I've been with the YMCA now 14 years, and we have an extremely high brand awareness level and a low brand understanding as to what we actually do. And it's something we've had to work on. And showing our impact is one part of a much wider journey that we've been on. I mentioned in thing about the branding. So some time ago we've had at the time just over 100 YMCAs, and every YMCA would have its own branding. I should say YMCA England and Wales is not a head office. YMCAs are individual entities, their own charities, their own boards. And actually it's a strength of ours, is the fact that because of that we've been able to, different YMCAs respond to their individual communities and what their needs are, and probably one of the reasons why we have survived so long. But actually, from a brand marketing impact data, that's more challenging for us. And so for me, in terms of our data journey, there's been two hurdles really. One is around culture, and I think every organisation has this. Our YMCAs are very different in size. You have very big YMCAs, right through to, it literally is a centre where a local volunteer will open up twice a week and then close it up again a couple of hours later. And when I turn up saying, you must put this branding in and this impact, look at me as if to say, go away. And I have been called the suit from London. So, so for us, it's been about actually recognising that we need to show not just each other, but actually the external world as to what we do, because we want people to understand what we are delivering. And so that's been a journey for us. I think actually the period of austerity actually made us focus our minds very much because there was less money around, and we had to show why we were different. And I had one of these things of quite early on when I joined YMCA. It was kind of doing how do we address this? And we had a couple of efforts which were total failures because they relied on different people in different YMCAs filling in forms to send back numbers. And you know what happens in reality, it doesn't get done, you're chasing them up, people leave, so they don't, the next person comes in, doesn't know the history of it. And I had kind of put, Ross said about the too hard to deal with shelf. And I was about to put up, and then my chief exec came back one morning and said, I've just met a guy called Matt at a breakfast who I think might be able to help you. Because I really had said this is going to work. And that's when my relationship with Trust Impact started, about how we can work on a model that gets rid of that, people working on different systems and different bits of paper, and being able to show it very easily, very simply, for people to see about what we do and what we deliver and what impact we are having on our beneficiaries.
Fantastic. Thank you so much. So, what we're going to do now is each of our lovely panel members is going to show you their dashboards. Some of you may have seen these dashboards before. You will not have had the same tour that you're about to get, because obviously this is where they came about from and why they're so important. So Julia, we're going to go to Julia's first for Cadent Foundation. And Julia is going to talk you through the process and incorporate into that some of why it was so important for them, the difference it's made, that being able to show that live data. So Julia, over to you.
Thank you. So this is our homepage, if you like. So if you come to our impact dashboard, this is what you'll see first. This is a collective view of several of our partners, our larger partners at the moment, I should hasten to add. So these are the ones who have a national footprint as far as Cadent is concerned. You can see here at the bottom, we've got the indices of multiple deprivation, and that was quite important for us to identify where we have areas of fuel poverty. So I should probably go back. Our purpose is to help people, help households find sustainable solutions to fuel poverty. It fits well with what we are as an organisation. We're an energy business, and we are seeing firsthand day to day how people are struggling in their homes, even more so now with the cost of living. So this dashboard is designed to link quite closely to our purpose. So at the top, you'll see how many households we have helped to date. This is fed by live data, and this is through 3 of our partner organisations. So it's not all of the work that we do. So the link to households is really important. The second bit is about energy efficiency. Energy efficiency being one of the 3 core problems that we have with fuel poverty. So energy inefficient homes is a major issue. And then the third one at the bottom here is around income. So the other problem that we have with people in fuel poverty is they generally are on low incomes. And so actually being able to help people be able to access benefits, manage their debt, find more income is really, really important. So this home screen really does sort of capture the 3 key areas of what our purpose is. And you can click on the indices of multiple deprivation at the bottom, and then you can see, are we actually targeting the areas where we are needing to target the most, and we also look at fuel poverty data as well from the government websites. So you can see how that helps us when we're demonstrating to stakeholders that we are actually targeting the right areas. So that main slide, we're going to show you a little bit of a view now of one of our main partners that we work with. So we work very, very closely with Groundwork and their Green Doctor programme. The Green Doctors are a federation of trusts, so they all work quite individually. So this is one of the big challenges that we had. And we work with a national team at Groundwork. So we set out with them, and these were our first partner, really. And building the trust and the relationship between an organisation and Trust Impact and ourselves is really, really key. And because we're not in charge of that data, we were asking them to share that data with us and share it live. So there's a lot of nervousness around doing that. As you can imagine, there's a lot of data out there. So Alex and the team have done a fantastic job of building that trusted relationship with the charity themselves to be able to pull through certain bits of key data, again, aligned to our purpose. But what we wanted to know is actually how many households are you supporting? But we actually wanted to understand what that carbon saving looked like, because actually that's really important to us. Also looking at the savings from practical solutions. So we have to use proxies to calculate some of this. So again, we went to Energy Savings Trust, we used their proxies, we build that into the model. So if you've got somebody who's replacing all their light bulbs in their home with LED light bulbs, actually, what does that translate into as a cost saving for that household? Same goes for if you're putting in double glazing in your home, or you're putting in cavity wall insulation. All these things have a proxy attached to them. And then through that, behavioural change bit was really interesting. So the unique thing about Green Doctors is they go into people's homes, they sit down, they do that work directly with the household, but they actually look at changing the behaviours in that house. So they then revisit them in about 8 weeks' time to actually make sure they're being sustained. And so it's quite interesting to see the behavioural changes that are being maintained here by consumers in their homes. On top of that, the other bit that we wanted to focus on was also the dwelling type. So we've got sliders on the left-hand side here, so we can look at whether they are in their own home, whether they're in private rented, or whether they're in social housing. Again, that helps us sometimes to target where we need to do the most work. And quite often we're finding, obviously, landlords have got responsibilities, and social housing is quite good at doing some of this. Private landlords, unfortunately, not all of them are good landlords, and we have to try and help the clients to be able to tackle those situations with their landlords. And then we've got the people who are just about managing, people who are in their own homes, and unfortunately, you know, they are working, they have got families, but they really are on that sort of borderline of falling into fuel poverty. So that's really key for us. And then just making sure that we're being inclusive. So ethnicity is really, again, important for us. So we want to make sure, looking at the indices of multiple deprivation and overlaying that information is actually, are we making sure we are targeting the right people in the right areas? So again, we wanted to build that into the model. And some of this is very, very sort of, lessons learned. Maybe we need to tweak that. Maybe we need to change this. But it's actually really, really useful when you're talking to any stakeholders or charities that you can show them a dashboard like this so they can see what we're trying to achieve. And then the final one I wanted to show you is our Winter Support Fund. This is quite new for us. We launched it last year, and we just started our second year. So this, at the moment, is showing you our new year. So we've committed to deliver £2 million worth of funding this winter. And it's distributed through all of our charity partners there. So you can see our trusted partners who are doing this on our behalf. This year is started on the 1st of October. So you can see very clearly that from the very beginning of October, we've already distributed nearly £500,000 worth of support. We do it through a platform, which is supported by Caris. So Caris enable us to do this. We give access to the dashboard to all of our partners, and then they can distribute vouchers for energy, vouchers for food, which is done through supermarkets. But we also have household appliances, and we also have people home and personal heating. So that could be anything from an oil-filled radiator through to a heated throw. We've got duvets, we've got foot warmers, you name it. We've probably got it on the list at the moment. But we also this year are doing household appliances. So this enables some of our partners who are particularly working in the health environment to get discharges from hospital. So quite often people can't come home because they haven't got a fridge or they haven't got suitable, adequate for heating in a room where they might have to be staying because of mobility issues. So we've given some of our partners access to even more information on there. So it's working really, really well. And obviously we gave £2 million last year as well. So it's a big commitment. One thing I want to draw your attention to at the top there is that we've got like a polygon that we can draw. So we can actually look at an area if we wanted to, particularly. So we work in network areas. Cadent, as a distribution business, we cover this geography. And quite often we're being asked, so what does that look like for the Northwest? So we can draw that polygon and we can actually have a look at, we can see where we're distributing in the Northwest. You can zoom in, you can go into sort of city level if you wanted to. So yeah, I'm really proud of what we've achieved. We are trying to do more as always. And we want to bring in some of our smaller regional partners into this process as well. So at the moment, I say it's just looking at 3 partners, but the ambition is to grow it and take it further. So.
Brilliant. Thank you so much, Julia. And if you've got any questions about that, please obviously pop them on the Slido in your app. So Jason, we are going to go to the YMCA England and Wales dashboard. So over to you.
Thank you. So I'm going to take you through some parts of the dashboard that we've been working on. It is a public dashboard. It's done through impact.ymca.org.uk, and you can access it straight off our website. And also we use it we call it our Y Hub, which is our internal digital app for all our staff and volunteers. It can be directly accessed by them as well. I think to explain the different work areas we have 5 work areas. We have such a wide range of services and programs that we offer. It's very difficult sometimes to have them reflected quite simply. And so when we did our brand and purpose work, these were kind of the 5 areas that seemed to drop out. Not everything kind of fits in. We actually run a crematorium in near Cardiff somewhere, so I'm not really sure where we put that. But it basically captures most of the work areas that we do. And it's always saying, although I do this every day, I always write them down, because whenever I do these, I get to number 4 and I go, what's the 5th one, as I'm trying to say it. But obviously housing, training, education, family and youth work, support and advice, and health and well-being. And so I was going to have a look at the housing dashboard first. This was the first dashboard that we did. And the reason we did it, because we felt that of all the work areas that we covered, probably most YMCAs who were delivering housing, because of the regulations involved, would probably be measuring something similar because they need to report on it. So we felt this would be a really good place to start, and that's why we chose housing itself. And so what you'll find on here is we start off with just a little bit of a description about some of what we do in housing, and then you'll see underneath the 6,211 people with a safe place to stay. That's a real-time figure. So how this has been done is that you have, one of the challenges we always had was that I said to you about being a federated structure. You end up with all YMCAs are making at different points different decisions about what data management systems they're going to use. Some are on Salesforce, some are on this. And in the past, it's how on earth do we get all of those to say the same thing and be able to measure the same thing? And this is what Trust and Impact has been really successful in doing for us, which has been able to bring all of those systems together. And from our YMCAs, when they make changes, it automatically makes changes onto our dashboard. So when someone leaves, that figure will go down by 1, and when someone comes in, that figure will go up by 1, which has been a great way of us then getting rid of the other problem I said earlier, which was relying on people filling in forms or filling in some sort of online app, and people are just too busy and they get behind and they just don't do it. And in the end, your information becomes kind of out of date and not very accurate. And so we have the 6,211 figure, and plus also the average time that someone will stay with us, which is 11 months. A lot of people can stay with us literally days or a couple of weeks, and some people stay with us a lot longer, but it averages out at around 11 months. And so I was obviously got the map, but I'll go back to that in a moment. But obviously on the other side, we wanted to just show that although we've got 6,211 at the moment, but with people going, we wanted to show that actually it's about 8,460 in the last 12 months. And also what people go on to do. That's our impact. It's we've given them support, housing support, but where do they go from there? And I was Matt, when his opening comments today, said around showing when things don't go well as much as when they do. And I think we wanted to be really clear about that. We actually think it gives credibility to the figures of when things have gone well, when you're actually prepared to show of the times it hasn't. So over the other side, it will tell you where they go. So if you go on the group departure destination, more appropriate housing, and then the individual departure destinations, you'll see the figures that are in green are the ones that we believe have been positive, and those who are in red are either not so positive or negative, or unknown. That's still an issue that we still have. It's about where do people go. And so you'll see in there that we actually have put in things that where people have been evicted by us or have been taken into custody. It is just the thing of the day-to-day, and that's to be expected. We are dealing with some young people who have some real challenges, have come from really challenging backgrounds, and so things don't always go right, and we show that too. If we go back to into the map, obviously these are showing national figures. We want to also show the local figures. So St Paul's Group, for example, which covers part of London and goes out into Berkshire, it then will focus in onto the geographic area where it is, and then you'll see that the local figures are then displayed, and in the same way as the national figures are. And so why have we done that? I mean, literally, this is a joint project between us as National Council, but also with the local YMCAs. We want them to get something out of this as well, which is being able to talk to their own local authorities, to commissioners, to public services, to show what they're doing and how they're also contributing towards the national figures as well. So that's quite important to us in terms of being able to do that. And I'll just kind of flick on to the next area, which is Brunel Group, I think. Just to give a sense of the same thing around what they deliver. So it can be used quite effectively for just to show what's happening in different parts of the countries and then how it all comes together to showing our national impact. If we then move on to the other dashboard, which is training education, again, we're doing the same thing. We did a slight change on this. We've decided to use heat map instead, because one of the things, so for example, probably by far our biggest deliverer of training education services, Central YMCA, which they was based in central London, actually operate YMCA training, and they deliver right round the country. And so we wanted to be able to reflect actually the different areas in which they are operating in. So the training education, again, we are similar format. As you see, we've got the numbers trying to show what people have done it in and where they've gone on to once they have finished. And if we then move on to the family and youth work, again, we've been trying to look at two key areas. And one of the challenges, this particular area was the one, I remember this, is that I think one of the things you have to almost work through at the outset is that clearly you have a lot of people, professional staff, very passionate about their areas, and they measure lots of things. And it's actually working out what out of all of those figures that you've got do you actually want to measure publicly. Because if we actually did put up everything that was measured, we'd have a whole telephone directory up there, and people would probably switch off within about 5 minutes of looking at it. So it's actually trying to understand what is it we most want to show. So the family and youth work does cover a lot of service areas, but we decided to focus in on our early years and childcare for the most part, and also our youth work. And also you're seeing here as well the index of multiple deprivation. We use that as well because equally we want to be able to show that we are reaching communities that potentially traditionally have been more hard to reach, and particularly like childcare. It's showing it's not all from 7, 8, 9, 10s, that actually we are able to deliver childcare in areas of of 1, 2, 3, and 4, which tend to have been the most deprived communities across the country. And so we kind of show the family and youth work there, and it just gives you a sense as well you'll get from this. So if I just click on St Paul's Group again, you'll see very much about how much they do around early years, and maybe not so much around the youth clubs. And then if you click onto Bournemouth, you'll see you get a very similar thing, but the early years, very much the majority about what they do, because no YMCA is the same. Every YMCA delivers different services. You could go to the YMCA in Derby and you'll see 4 or 5 different types of services. Go up the road to Nottingham, completely different way they do things. And we're not McDonald's. You don't have the same menu wherever you go. And we want to be able to reflect that. Then we look at the support and advice, which is the latest one that we launched last year, wasn't it? Early this year, yeah, in July, which is a lot of our kind of different services. We give so much support and advice on different things. It could be housing advice, mental health advice, just kind of coming in and talking about things, different subject areas. It's very difficult to actually categorize this. But I just wanted to kind of give you a sense, again, the heat map, the numbers of people that we are supporting right now, and also using the index of multiple deprivation. So if you click on Downslink Group, for example, you'll see, so Downslink Group covers the South Downs, so it's kind of Brighton area and East and West Sussex. You'll get a sense of high numbers, but you get a sense of the sort of services that are more generalised support and advice. And you're seeing that it's a broad range of different areas within the index of multiple deprivation. But if you then compare it to Humber, now Humber are coming up with smaller figures, but notice the targeted nature of their support and advice programs, which are really some of the most challenged kind of groups within the index of multiple deprivation. So I hope that's given you a bit of thing. We've still got one to go, which is the health and well-being. Interestingly, the last one, it was the second one we started. It gives you a sense of some of the challenges we've had. And often it's around trying to integrate all those different data management systems to say the same thing into the same system. I was going to say it's a work in progress. but I'm not actually overly sure you ever finish. I think because the moment you finish, you then need to revisit to think, are we still measuring the thing that's appropriate and what is needed? It might have been 3 years ago when we started it, but things all change, especially with different political priorities now coming through. What do we need to do to keep this going forward and relevant as we move forward? Thank you.
Brilliant. Thanks, Jason. Right, we're going to flick on to questions. And just as we go to those, I'll just say, Jason, yes, it's a lifetime commitment. You are stuck with me forever now. So I'm going to start. Julia, it looks like the first one's for you. So the Cadent dashboard shows numbers of what's been done. Are you using it to drive decision making?
Simple answer, yes. So when we first started this journey and we had our maps and it was great, our foundation advisory board, our board is very different. They're mainly derived from the Cadent board, so they are corporate people. The chair of the foundation is the chair of Cadent, so they are very, very keen on, they don't look at the positive sometimes, which is very frustrating. They look straight at, well, there's a gap there. What are you doing in that area? So yes, it does drive decision making, and very early on it helped us to look at the map just visually and say, we're not doing much in this area, this corridor. Why is that? And it enables you then to go and do a bit more research. It helps you to identify there's not a huge amount of deprivation in those particular areas, and that might be an area that we want to explore. Is it because the data's not there, or are there pockets of deprivation or fuel poverty that we should try and focus in on? So yes, it does drive a lot of it. And then I think the other bit it helps us to look at is when we start to look at sort of age profiles of groups of people that we're supporting, are there some gaps in that as well? So that's where we are at the moment.
Brilliant, thank you. And just to be fair, I'm going to do a YMCA specific one as well for Jason. So Jason, is there another version of the dashboard that is internal only? Were there any concerns about this being fully public?
We do have more figures than what we have publicly. Is there another version of this that's got a lot more in behind the scenes? No, is the answer. But we obviously do have access. It's a really good question about, putting things out in public and what the reaction may be. I kind of reiterate what I kind of said earlier. We did debate it at the time, but I think it's really easy for us just to put out the figures we want people to see, and it makes it kind of the rose-tinted view of what we deliver. And that may be easier in the short term, but actually I think people accept that there are times where things aren't so good, and actually by being upfront and straightforward about that, it makes the acceptance of all the other stuff that you do that's great be accepted as actually valid. And so for me, no, we've had no donor or no supporter has been on the phone to us and said, I'm absolutely outraged that 30% of your housing placements in this area didn't go on to be positive. We've not had that. In fact, all we've had is the opposite, which is how good it is to see and how easy and it was to navigate. And people actually, they always like to see the local, because people always tend to put in where they live and see what's happening in that area. So at the moment, no, we've not had concerns, but things can change. But yeah, and there's no secret version behind it.
There is not, I promise you. So one coming up both of you. Now, I'm conscious neither of you are techie people, so don't feel intimidated by this one. But for both of you, can you speak a little bit more about your data sources and your live connections to your data sources? And I think we probably haven't got a particularly techie audience either. That's not to insult anybody. So speak to it to your level. That's fine. I think it shows how accessible it can be.
Okay, so limited knowledge here. We don't have the charities that we are working with. I don't think any of them have got the same CRM system at the moment. So they're all using something slightly different, and then we had one of the organisations, the Groundwork, which changed its CRM system partway through this journey. So it was like, well, we've got data on here already. We need it to match. So there's a lot of work that needs to happen. Alex and the team use a system called Connect, Mix, Share, which means that they can take data from lots of different sources and pull through the data that they need to extract. So yeah, I think that's my answer really. I don't know all the different names of all these different systems, but the way it works is that they will work with the partner, look at what their data source is. Some of it is very basic, some of it's more complex, but they put it through Connect, Mix, Share to make sure the dashboard shows what we need.
I call it a magic Hoover, Julia.
It is. Sums it all up.
That's my level. Jason?
It's so good you go second. I agree with everything. That was just... we also have Connect with Share as well. I think the real challenge has definitely been, each area, housing, we could have 4 or 5 different systems in operation. We moved on to then, health and well-being, which has been a real challenge. Again, another 4 or 5. And so by the time we finish all of our dashboards, we probably could be having 20 or 15 to 20, certainly different systems that we've had to try and bring together into one. And that's where the wonderful Trust Impact team come in, because, although we are a national charity, we are a small team. We simply don't have that level of expertise and knowledge within our team at National Council to be able to do that. But we use the Connect, Mix, Share as well, which then enables it to bring it all together and also to share with each other, which I think is well used within the YMCA, where they can share more data with each other at that point.
Fantastic. So we're very near the end. So just a very quick answer from both of you, because I think GDPR is really important for people's minds. So Jason, I'm sorry, I'm going to go to you first, but very quick answer if you can for both of you. How do you navigate GDPR challenges using personal data of often vulnerable people, absolutely, to create these dashboards?
We don't ask for individual data. We ask for figures, and we have a data processing agreement in place between National Council, YMCA's individual YMCA, and also Trust Impact. But we don't take from the system does not take from local YMCA any individual data. It's only collective data that which is obviously displayed up there. So that's how we. And that's also important to YMCAs. It's always the first question we get asked, what does this mean for GDPR? And actually we explain very carefully, we've been really to make sure all the controls are in place to make sure we are only taking collective data.
Brilliant. And Julia, if there's nothing to add, don't feel obliged, but if you do something slightly different from your end, feel free to add.
Very, very similar. We make sure we don't use the dashboard for any personal information. The dots on the map are the outcode only of a postcode. So yeah, you could never drill down to a street to identify a potentially vulnerable person. So if you're looking at ethnicity or type of house, you'll only get the town postcode outcode. So yeah, that's how we tend to keep that.
Brilliant. Right, we're going to wrap up there. Thank you so much to both of you. That's been fantastic. Over to David.